See you.
Thank you very much for the introduction. Hello, everyone. I'm Erin, and I'm very excited to be here. So, because the paper that we'll be talking about today surrounds psychedelics, I'd like to get us all on the same page and orient us towards what psychedelics are, their history, things like this. So, as Danielle said, psychedelics are generally described as substances that alter perception, mood, cognition, often inducing really profound changes in consciousness, and that bleeds into people's daily lives in the short term and in the long term. So examples of some psychedelics include DMT, MDMA, or the very popular LSD. There's also ibogaine and then psilocybin, which is the drug that the paper uses in the experiment. And then you can see the chemical structures for four of these on the left. And then on the next slide, I'll go through a brief history of psychedelic use according to their indigenous use, Western popularity, and then the subsequent backlash from the US government, and then the current modern revival. So we can move to the next slide. Okay, so here is the timeline. So psychedelics are often associated with the anti-government free spirits who thrived on protests and LSD in the 1960s. However, psychedelics have been used as sacred tools for thousands of years by indigenous people, primarily in South America. And the earliest evidence of this goes back to about 5,700 years ago in eastern Mexico, where carbon-dated peyote cactus buttons and mescaline-containing red beans were discovered in human-inhabited caves. If you're interested in reading more about that, I think Maria will drop a link to a paper about it by Rucker into the chats. And then speaking more on this, indigenous use was violently policed, mostly by the Spanish Inquisition. There's also another really, really good article about this by Petter Johnstad that Maria will also drop into the chat. And I really like this paper. It goes beyond just psychedelics. It goes into marijuana as well, other drugs, just the overview of the racial and religious motivation behind drug criminalization, which is very relevant for what's happening in the modern day. So I would definitely recommend giving that a read. And then moving further down the timeline, there's also not to scale, by the way, but psychedelics started moving into the Western world, and particularly in the US in about 1895, when Prentice and Morgan reported indigenous people like ceremoniously using peyote cactus buttons in Central America, which the Rucker article mentions and talks about further. And then they were further embedded when Arthur Hefter isolated an active ingredient of peyote called mescaline in 1897. And then mescaline was made available for research by a pharmaceutical company called Merck & Co. in 1920. And then later down the line, psychedelic popularity really took off in 1938, when Albert Hofmann synthesized a chemical that was later derived into LSD, which the Rucker article also talks about. And then in the 1960s, psychedelics took off in US popular culture, mainly due to psychedelic praises sung by scholars like Timothy Leary and those kinds of people who are very active in psychedelic research and popular culture. The two intermixed a lot back then. And then very soon after widespread popularity amongst the Americans, LSD possession was criminalized by the federal government in 1971 with the Controlled Substances Act, and this was written into law by Nixon. So modern times have seen a resurgence in scientific interest around 2006 or so with schools like Johns Hopkins, Imperial, more recently like Berkeley, UCSF, Yale, like NYU, a bunch of different schools are starting up clinical trials, therapy programs across the board. It's been a spectacular resurgence. And then also organizations like MAPS, use so in a whole bunch of different organizations. So far, clinical trials have shown efficacy for PTSD and depression, addiction, anxiety, tons and tons of mental health related disorders. It's been incredible. And now we can move into the next slide. Okay, so because the paper that we're going over today uses psilocybin in the experiment, I thought we could orient ourselves a little bit more. I'm sure a lot of you are familiar with psilocybin, but just to get us all on the same page, for thousands of years, it's been used in Mesoamerican spiritual practices, prominently featured in Aztec ceremonies. It made its way into the Western world in the 1950s because of R. Gordon Wasson. This was not a great story. He and his wife went on expeditions to Mexico to study the religious use of mushrooms by the native population. And then the curandera Marina Sabina allowed the Wassons to participate in a mushroom ritual and taught them about the uses and effects of the mushroom. But this was only because Wasson lied to her about being worried about the whereabouts and well-being of his son, as the ritual was traditionally used to locate missing people and important items. I would highly recommend learning about Marina specifically, but Wasson as well, and just that history. So a very good place to start would be their Wikipedia pages, and then on their Wikipedia pages, there's a bunch of links linking to books and podcasts and other things where you can learn more about those stories. And then here are some of the general effects in the next block. And then the next block talks about the neuroscience of it. So it's converted into psilocin primarily in the liver, and then that crosses the blood-brain barrier and activates 5-HT2A receptors in the brain. And then it helps different brain regions talk who wouldn't normally talk, and it can produce a lot of the effects that are shown in the second block. And then the next block shows an overview of the trip timeline and what psilocybin is being used for in current research, what current research is looking at. And now we can move to the next slide. All right, so moving on from very backgroundy stuff, let's go into why should scientists be familiar with why read literature at all when writing your own paper or just as a curious person. So the first thing is that you can find important information in designing new experiments. So if you have an idea, but it's already been done, then you can say, okay, well, I should probably differentiate it in some way or further the information or contrast that information instead of just doing the same thing again, because repeatability is really important, but spending time and other resources, especially money, on the same exact thing is not that great. So being able to see what data already exists and then building off of it, contrasting it, is great for the literature. And then number two, scientists can provide supporting evidence for their claims. They can, like I said before, support or contrast their own data with existing data. Because even when an experiment contrasts previous data, that still builds the overall pool of data. Because now you know, okay, well, now I have something that says the previous knowledge might not be as accurate as we think. And that in itself is very important. And then citing your sources is pretty important in science. So if you know existing literature, you can say, okay, this work was done by this group or this person and give the proper credit. And we can move on to the next slide. And if anyone has questions throughout, this is a ton of information. So if you do have questions, please drop them in the chat. And Marina, Danielle, or others will answer. Okay, this slide is the general flow of a paper. So I'm sure a lot of you have read research papers before. So you're probably very familiar with this flow, but it'll be important to keep this in mind for the next slide. I'll contrast it a little bit, but so you have the title, you have your abstracts, you have your introduction, etc. It's usually very linear and standardized. But moving on to the next slide, despite this general flow, I would suggest reading a paper a bit differently than how it's constructed. So, of course, there's no one true method, but this is just a general suggestion. I pulled this graph straight from a class that I took this past semester called Scientific Communication, where we went over how to read papers in the most effective way. So it's a very nice graphic to go off of. So I wouldn't recommend just going top to bottom like what was displayed in the previous slide. It's definitely true that research papers adhere to a standardized format, but using a targeted reading might help you find the information I need faster. Because some of these papers are very long. Like even today's was about 17 pages, including the references, which take up a lot of room, but still, like we don't often have the time to go through every important paper all the way through, especially because you might have a paper and it turns out to not be very relevant to what you want or your research and what you're interested in. So I would generally start out with the abstract, and we'll go over the abstract for the paper that we have today in the next couple of slides. But the abstract gives you a very nice overview of the paper. It's very summary-esque. But that in itself is very structured, which we'll learn soon. And then the last paragraph of the introduction, and then the first paragraph of the conclusion offer usually pretty broad writing about the experiments and their findings. And then the results section, header titles and figure titles, if they should definitely have figure titles, which will help give a summary of each figure. But then the results section, header titles, if they have them, is also a very nice overview of what it'll talk about. And you can kind of decide right then and there, okay, this isn't really something that's going to be useful for me, or this is definitely going to be useful for me. Let me do a more in-depth reading, which would start with the introduction, the results, the methods. Yeah, so we can move on to the next slide. All right. So as I mentioned in the previous slide, the abstract is a very, very good thing you want to read, like pretty much right after the title. You don't even need the title, but like the abstract is really where you want to start. And I also mentioned that it's usually pretty structured. So you have generally the purpose and motivation, which starts very broad, and then the problem, like what is the research group trying to understand? What's the purpose of doing the experiment at all? And then the approach, which is like a bird's eye view of the methods that they used, the results, what did they learn? What did they not learn? And then the conclusion, which usually begs the question of, well, why do we care about this experiment? Why was it worth doing? And then what would be good for future experiments? So then we can use this analysis in the paper that we have for today. So we can do that in the next slide. It looks like someone has their hand raised.
Yeah, I do. I wanted to ask a question
Hi.
regarding abstract. So you put in the previous slide conclusion and everything. So just to clarify, you're saying that the abstract and the results conclusion are separate from the abstract, not like one of the components of the abstract there, right? Just for clarification. Because the
Yeah, I
abstract,
get. Mhm.
because the abstract just talks about um the problem, yeah, and what you're aiming to research and what you intend to do, if I'm not wrong.
Mhm.
All
Yeah,
right.
like to me, there's like two different sets of conclusions. Like there's the very brief one in the abstracts, but then there's usually like a conclusion and or like a discussion question or section where they can go into that basically what they said in the abstract, but likely in a lot more depth and like, okay, here's a more detailed version of summary of what we learned. And then here's the general discussion. Like sometimes they'll do a broader context, like here's how our experiment fits into the general scientific literature. Then they're not just referencing other literature, they're building off of it, which is pretty helpful. And then saying, okay, now we need, because we have this data, now we need this other data to make the pool or whatever the topic is like really strong. Does that make sense?
Yeah, I just asked because in this slide, in this box with purpose, motivation, problem, approach, etc., it looks like
Mhm.
it looks like that it might be well to the audience the components of an abstract because though results and conclusions are separate from it.
Yeah, not really. I think of the abstract as just a squished version of the entire paper, more or less. Like it's usually pretty standardized. So you can find all of these components both in the abstract and then the expanded version is the paper.
All right, thank you.
Yeah. Okay. So that might be contextualized better with this abstract as an example, which is the abstract of the paper that we're going into today. So taking the first portion, the purpose and motivation, we can see that straight out of the box in the first two sentences. So cancer patients often develop chronic, clinically significant symptoms of depression and anxiety. So we have cancer patients, and then chronic, clinically significant symptoms of depression and anxiety. That's so you have your population, and then you have something that you want to help them with. And that's a pretty good motivator for an experiment like this, I would think. And then previous studies suggest that psilocybin may decrease depression and anxiety in cancer patients. So Griffiths, the one of the authors, was very nice in writing this. Like here, very straightforward. It's like here's a problem, here's how we want to solve it. And then previous literature has said it could be possible, so we want to add to that data. Like it's not necessarily uh, a causation, but it could be a correlation, and that's pretty incredible if you can get a good correlation in science, as I'm sure all of you know. But yeah, so there's the purpose and motivation right there. And yeah, so they're kind of saying, um, like you can see the importance of reading previous literature here because previous studies showed potential. So then they're going to show how their paper is different. They don't say it in the abstracts, but they do say um, in the introduction, they go on to say that previous studies with a similar goal, quote unquote, did not include the comparison conditions that would be expected of modern psychopharmacology trials. So the previous literature that they're probably talking about happened probably in the 60s and 70s. And there are very different scientific standards in the modern day. So I think that they're basically just saying, yeah, this is more according to modern standards, which really strengthens the data for this. And then so that was the purpose and motivation and the problem. It was kind of wrapped into one in these first two sentences, because then it goes straight into the approach. And the SN team will dive in. Oh, oh, I think someone's unmuted. Thank you. But yeah, so the SN team will dive into the approach later, but you can see it here in the second color block, kind of teal, dark teal looking color. And then the results, you can see it in the third color, which, yeah, go through the immediate and then the 6-month follow-up results from high dose participants. And they get pretty specific here, which is kind of nice for those who just like, okay, is this going to be useful for me or not? And then you can see it all right here. And there, really identify a conclusion in this abstract. Sometimes there is, but of course every paper is different. So there's always meaning in how they structure it. But they do write in the conclusion section of the paper that, quote unquote, a multi-site study in a larger and more diverse patient population should be conducted to establish the generality and safety of psilocybin treatment of psychological distress associated with life-threatening cancer. So, of course, in the conclusion, they do give a conclusion of broader future direction, broader significance, etc. Just not here in the abstract. Okay, now I'll hand it off to the SN team to dive into the paper analysis.
Thank you, Erin, for giving me the floor. So today, the research paper that we are talking about is how psilocybin produces substantial and sustained effect in treating anxiety, depression with life-threatening cancer condition. It is a randomized double-blind trial. So when we think about the treatment procedure cancer patients are going through, we often think about the physical aspects of the treatment procedure, the physical pain they are going through, the side effects, the surgeries, the radiotherapy, and the chemotherapy. But there's often a field of the treatment process that goes overlooked. That is how they're feeling, their mental health. So it has been seen that the cancer patient often undergo a severe anxiety, depression, and they have a reduced quality of the life. So throughout the time, the doctors have tried to deal with this condition with the typical antidepressants such as benzodiazepines, but it has been seen that the typical antidepressant that we are using is not producing substantial effect. The efficacy is not as much as we want them to be. And it comes with a plethora of side effects, which is not good for the patients. So what we need to understand that it's not just feeling down, it is a substantial part of their treatment process that will affect them, how they're going to respond to the treatment in going forward. So here is the part that the classical psychedelics comes in, that Erin has said the background for is we're specifically talking about psilocybin and LSD. So we have a preformed conception about these drugs, that these are the recreational drugs. But if we set aside our preformed conception for a moment, pharmacologically, these are specifically 5-HT2A receptor agonist, which produces substantial sustained effect in treating this condition that we are talking about, that is the anxiety, depression, and mood disorder, the reduced quality of the life for the cancer patient. So in the study, we are seeing how this psilocybin is producing this effect and how specific they are going to be, and how we can explore various different treatment procedure further going forward. So this is for the background of the paper. I think Maria will take on from here. Thank you.
Thank you, Famida, for presenting the background. So let's now talk about the methods of the paper. So the double-blind crossover trial design allowed each participant to serve as their own control, comparing the effects of a high-dose psilocybin to a very low placebo-like dose. So both the patients and the observer were unaware of the amount of the dose to be given. Participants were randomly assigned to one of two groups, which were the low-dose first groups and the high-dose first group. Data assessments were conducted at a baseline, which means that before initiation of the dosage administration, and then before and at the end of each session, 5 weeks after each session, and 6 months after session 2. Participants met with the 2 session monitors before the first session to prepare them for the psilocybin session, and they also met with the monitors after a session to discuss their novel feelings. Prior to sessions, participants were advised to eat a low-fat breakfast. The urine sample was also taken to confirm their abstinence from common drugs of abuse, and psilocybin doses were administered in identically appearing gelatin capsules. The cardiovascular measurements and various standardized questionnaires and scales were used to assess mood, anxiety, quality of life, spiritual well-being, mystical experiences, and additives throughout the study. So these included the both clinician-rated and self-report measures. Some questionnaires used were the five-dimension altered state of consciousness and mysticism scale, which are shown on the slide. And data assessments were conducted at baseline, which means that before initiation of the dosage administration, before and after each session, and at 6-month follow-up. And community observers, such as family, friends, colleagues, also provided ratings of participant moods, attitudes, and behaviors.
Moving on to the results. High-dose psilocybin produced substantial and statistically significant decreases in both clinician-rated and self-rated measures of depressed mood and anxiety. These effects were significantly greater than those observed with a very low placebo-like dose of psilocybin. With regards to adverse events, some participants experienced transient anxiety or discomfort during the high-dose session, but adverse events were rare and managed effectively. The reductions in depression and anxiety were largely sustained at the 6-month follow-up, and about 80% of participants experienced increased well-being or life satisfaction with a high dose of psilocybin. High-dose psilocybin led to significant improvements in various measures of quality of life, optimism, and overall well-being. Community observers also corroborated these positive changes in moods, attitudes, and behaviors. So looking at figure 2, which was included in the paper, there were transient moderate increases in the systolic and diastolic blood pressure after psilocybin, but none of the episodes of elevated blood pressure required medical intervention. So you can see in these first two, you can see how they both kind of increase. Time-related increases were also seen in the participants' heart rate and overall drug effect. Significant decreases between the dose conditions usually happen at the 30 or 60-minute mark. And the high dose typically showed peak effects around 90 to 180 minutes. So we can see there's a peak here and also a peak here, and that's also seen in the other charts as well. So I will be passing it to Famida to talk about the other charts.
Thank you, Daniel. So this looks like a very busy slide, but if we go step by step, the figure 3 shows the effects of the psilocybin in selected outcome measures. So we have 3 outcome measures here in different points of time. If we see, the first one is depression pointer measure, and second was the anxiety, and third is the quality of the life index. So we can see here a blue line and a red line. So the blue line is when the first group of the participants were given a low dose of psilocybin, and the red line is when they were given a higher dose of psilocybin. So it has been seen through, we can see in the graph that when they were given a load of psilocybin compared to a higher dose, they showed lower remission to normal scores. But when the psilocybin doses were increased, their they showed greater remission in this index score. So there was elevation in their mood, there was decrease in their anxiety, and overall quality of their life has been increased. So if we see in the figure 5, there is also blue dots and red dots here. So the blue dot signifies when the first group of participants were given a lower dose of psilocybin. And against that, we have the red dots when the participants were given a higher dose of psilocybin. So we are seeing here a mystical questionnaire, a mystical experience questionnaire. So when they were filling up the questionnaire, if their score was high, the higher mystical experience was correlated with the greater elevation of mood, meaning that they were feeling their life was more meaningful than before. So we can see when they were given a higher dose, there has been greater elevation in their mood, and their mystical experience has increased than before. So it looks a little bit busy, but if you just analyze the graphs here, this is the main summary of the results here. So I'll be passing down for the next slide.
Thank you, Famida. So, in the discussion, the paper talks about first, psilocybin is a promising therapeutic intervention. We see that beyond reducing depression and anxiety, participants reported broader improvements in quality of life, optimism, meaning of life, and decreased death anxiety, deeming psilocybin as a great component for therapeutic measure. So sustained therapeutic benefits have been also observed with effects lasting at least 6 months for the majority of participants. The finding also suggests that the integration of physical experiences are important in therapeutic measure. And now Danielle will talk about the future directions.
Yeah, thank you, Maria. So in terms of future directions, neuropsychopharmacological mechanisms of psilocybin therapeutic effects are still yet to be established, and the study had a relatively small sample size and focused on a specific population, which were cancer patients. So there is a need for further research with a larger and much more diverse population. The findings of the study can be compared to other psychotherapeutic and pharmacological interventions, so researchers should explore optimal dosages and other treatment methods, such as single versus multiple doses, and there should be a continued research of psychedelic assisted therapy in a much more structured and controlled framework. And so I'll be passing it to Famita to talk about some real-world applications.
We talk about the real world applications of psychedelics, the first that is relevant to our paper today is the palliative care. So palliative care is a form of care we give to chronically ill patient for elevating their quality of the life and elevation of their pain. So using the psychedelics as psilocybin in these areas could help chronically ill patients to improve their quality of the life in the overall process. So we can also use these components for treatment for depressive and anxiety disorder. As we have seen that the traditional antidepressant typically show less efficacy in these areas. So using these psychedelics for treatment of the traditional disease, mental health disorder that we are talking about, it could be a new explore could be explored in the research areas. It could be a new treatment revenue. We can also use them in psychotherapy, and also we can incorporate how to use these components in education programs for certifications for the psychiatrists and psychotherapists. But it should be noted psychedelics such as the things with recreational drugs. So this is a scheduled class 1 drug in many countries of the world, including the United States of America. So these drugs, their handling is controlled. So it should be kept in mind that they will not be found anywhere except the designated research areas. So apart from that, psychedelics can be can have really great real world applications. So this ends here. I think our discussion of the journal. I'll pass the handle to the.
So that concludes the summary of the research paper. I'll be moderating the chat and Famita will be moderating the raise hands. But feel free to unmute or type in the chat if you have any questions. So yeah. I think, Erin, would you like to share about contraindication and long-term side effects?
Yeah, psychedelics are kind of tricky in terms of because it's not a one size fits all, and they also impact people very, very differently. So some people can be predisposed to a challenging experience on psychedelics. Psilocybin a little less so, I think, than others, especially ones like DMT or ibogaine. I think people that are predisposed are like could be have a family history of schizophrenia, especially and other disorders. It might not be a great idea to do something that could really alter your brain in such a way. there have been reports of people going into psychosis and things like that. Not usually to the point of suicide, but sometimes I think there have been a couple of reports. So there are very significant dangers that people need to keep in mind in determining whether or not they should have a psychedelic experience. But like I said, also psilocybin, especially in lower doses, has shown overwhelmingly positive results for many people, like many patient populations. So there's not a ton of contraindication with psilocybin specifically, but I would definitely do your own research on that too. In terms of long-term side effects, there's not a lot of research on that because the research that was done in the 60s and 70s, I mean, those I again I say all of this with a grain of salt. I would definitely do your own research on it, but I feel like a lot of those patient populations are very, very old or beyond that, or they have just gotten lost because of the criminalization. So access to those patient populations has probably become very difficult. And then a lot of the newer research has only really popped up in 2006 or so. So I don't think science is too concrete on longer term side effects. Same thing with marijuana, etc. But yeah, it's a very novel field, at least in the modern with the modern research. So there's a lot to be discovered. Yeah. If you have a follow-up question, please let us know.
I think Arushi Verma has raised her hand.
Yeah. Hi, Fahmida. Thank you so much. Uh, Again, Erin, a wonderful presentation. And I really appreciate that you took this paper as an opportunity to talk about colonial and Eurocentric roots of indigenous drug criminalization. I think it is what the entire ethos of Simply Neuroscience is all about. So, coming to my question, what ethical responsibilities do you think the physicians hold in having to inform the terminally ill patients about alternative treatments like psilocybin, which have the potential for recreation, but are not yet part of standard medical practice or conventional treatment?
Yeah, that's tricky because I guess there's the first option of having it presented as like equal to every other option. Like, okay, you could do this, you could also do this, you could also do this, and psilocybin or some other psychedelic just happens to be one of those options, which at least like I'm not a medical professional, I'm not sure how effective that would be or not, but at least it would put it on an equal playing field. Like if the patient's like, oh yeah, I would be open to having a psychedelic assisted therapy experience or something like that, then presenting all the information around that, the screenings, possible blood work, everything like that. So yeah, it could be effective to just present it as equal to any other treatment option. I feel like it would be very case by case between patient and doctor. Does that answer your question well? Yay.
I think we have
Yeah.
another question in the chat. Maria asks, do you have any advice for analyzing and synthesizing scientific literature for someone who's new to research?
I mean, what I usually do is it's probably not very effective, but you can find just a chain of relevant research papers in the references. So just look up, even if let's say you're interested in psychedelic treatments in general, you can just go to the paper that we talked about today, go to the references and just click on those, and then those have references. And so it's like an infinite chain of papers that get more or less relevant to your question and curiosities. Another thing you could do is just go into any database of articles, whether like bioRxiv, for example, has a lot of preprints, so you would get a lot of the newest research there. But there's also the fully published papers in like SagePub, PubMed, JS2R, all of these like neuroscience, yeah, like very established reputable journals that you can go into, and there's a whole science around typing in keywords into the search bar. So there's a lot of pages on that. I'm not thinking of a specific one. I think a lot of university library pages will have instructions on that, like how to find a research paper effectively. There's a lot of tips and tricks, like going into the search bar of like for example, the search bar of PubMed and looking for a topic that you want. So I would definitely do research on that, but hopefully that was helpful. And then at least in terms of the analysis part, like looking at the general guide I gave earlier, just not like start with the title, like, okay, this is completely irrelevant. Like, okay, this is kind of relevant. And then going into the abstracts, okay, this is still relevant. And then so on according to that graph. And this is being recorded, so you can go and look back at the recording and see the graph.
We have another question. Are there by any chance any research or internship opportunities you currently have? And if you don't, maybe some advice on how to get internships?
Yeah, I got super lucky with the one I'm doing with Cart Harris because it was a cold email, which is what I usually hear from other people too, like anyone like in the neuro department at my school that are in labs. I'm like, oh, how did you get it? Just out of curiosity. And they're like, cold email. Or they knew someone, uh, which is unfortunately how a lot of things happen in science, in the world in general. But yeah, it was a cold email to, I looked up the personnel of Robin's lab, and then her, like this person's name came up, and I was like, are there any openings? Like, how can I get involved? It wasn't necessarily like, can I have an internship? Can I have this job? It's more like, I'm curious about the work being done in this lab. I'm very interested in it. Like a lot of authenticity in your email definitely helps. Like if you don't care about the research, probably don't email them. But if you are very interested, then that'll show. Like they can tell most of the time. Kind of like college admissions folks, they can usually tell if a student really cares or not. But yeah, and then once I emailed, she was like, yeah, we have some opening for a volunteer position. And then it's been about a year now. So yes, but I would advise cold emailing. There's so many infinite templates out there for and guides on how to write a good cold email. Yeah, hopefully that was helpful.
We have another question by Maria. Have there been any other similar studies using other psychedelics that you'd prefer to look up?
Oh, it looks like Amina was very helpful in answering this. Yeah. I mean, there haven't been a ton of research with other psychedelics beyond psilocybin. So I feel like psilocybin's the easiest to get. And I feel like it's also really versatile in terms of what you want to experiment with, whether it's depression, anxiety, PTSD. MDMA seems really good for PTSD, so there's a lot of research on that. Psilocybin is primarily depression and anxiety right now. I haven't seen practically anything with ibogaine. Same with DMT. I feel like DMT is very much centered in either assisted therapy or retreat centers. Same with LSD. Yeah, a lot of the research is primarily psilocybin. Yeah, but I would say that Cart-Harris, like Robin Cart-Harris, has so much research under his name. Him and his colleagues, which you can find, most are from Imperial College London. But there are also a lot from him at UCSF. Yeah, he's one of the main guys. Other folks that are really involved include like Jenny Mitchell, Michael Silver, Daniela Kaufer, Andrea Gomez, exclamation point with Andrea Gomez. Yeah, yeah, I'll stop there.
Also, Maria just put in the chat some databases, so feel free to take a look at those. Gabby asks, how might the lack of diversity in the study population influence the generalizability of the findings?
I guess it really impacts it. This in terms of, yeah, like I think that's been a problem, especially in research being done in retreat centers. There's been a lot of community type research, like how does being in a group impact the psychedelic experience, or testing it in general in those kinds of settings. But there's a lot of socioeconomic issues with that, because you'll see a lot of like affluent white people going down to South America or something and doing retreats down there. That's a very specific population of people, and often the people that don't actually benefit the most from the experience. It's incredibly beneficial regardless, usually. But it is a very specific population of people. So there needs to be more research done in Black and Brown people, Indigenous people, and there's some, but like it, even from a scientific perspective, it's not as generalizable as it could be, because there are certain groups of people that are not included in the research. So yes, I hope that answered it. There needs to be more diversity in psychedelic research. I think hopefully that's good.
I think this might be the last question, but Tristan asks, I saw in the research paper that the patients were given specific music to listen to during the experiment. What role does music play in psychedelic experiences and also neuroscience in general?
Yeah, this is very unanswered, I feel like, in the literature right now. I think this goes back to set and setting, where set is your mindset going into the experience, whether you're informed on the substance you're taking, how it might impact you positively, negatively, neutrally, the context of your life at the moment, if you're getting a divorce, if you have a kid on the way, if you have a big exam coming up, all of those things can have an influence on your experience or not. And then the setting aspect of it is the environment you're in when you take the substance, whether there's music playing, for example. I think that could have a huge a huge impact on it. There's a lot of research being done in set and setting. Cart-Harris is doing studies on that. Other scholars as well. Music is like the sensory experience in general, I think, is a big part of it. So if you're in the middle of a jungle, or you're in a very sterile white room where it's like dead silent and there are like clinical monitors looking at you, or it smells good, it smells kind of bad. I think every sensory modality plays a role in the experience that you have, especially music. Yeah, there's a lot of artists I feel like that are popping up. There's one person named East Forest that does a lot of playlists for specifically for psychedelic experiences that are being used in studies, if you want to give that a listen. I think generally people are given options of which playlist they'd like to listen to if they want to listen to music at all. Some people, their thoughts are their music or something, but anyway, I think it plays a humongous role, but it differs from person to person. I don't think the literature is too settled on it yet.
Oh, I can also share a little bit as well about music too. So I currently volunteer at a memory care facility, and music has also shown a lot of positive benefits in the application of dementia and Alzheimer's. And listening to familiar songs from the past can help unlock memories. So there's a lot of different applications for music. I'm a little biased because I'm also part of an orchestra, but music is really fun. It's a definitely valuable experience. So yeah. And then I guess we can have one more question. Was psilocybin found to be addictive for patients that have survived cancer or other chronic diseases?
I don't know. I wouldn't think so. I would definitely do your own research on this. I will too now. But I think the general literature says that psychedelics in general are not addictive. But again, I think it depends on like if someone is predisposed, like if they're having a really rough time in life, and for example, MDMA makes them feel incredible and they start to become dependent on it, that could be a type of addiction, but it may not be because of the neurological effects of the drug. It could be because of the how it makes them feel, the context of their life. So I think an expansion of like our definition of addiction is needed in the psychedelic space. But I will need to do research on this. This is a very good question.
So that
But I
concludes,
wouldn't think so. Yeah.
oh, sorry. That concludes the Q&A session. If you have any other questions, feel free to reach out to Erin. Her email and contact info were listed by Maria in the chat. And then I'll be passing it to Maria to give some final reminders.
Yep, so thank you so much for attending the first Synapse session. I'm going to put some links in the chat right now. So this is a reminder that the recording of the meeting will be on the Simply Neuroscience YouTube channel. The link is in the chat. If you are interested in attending future Synapse sessions, please subscribe to our newsletter to hear from future announcements. If you're interested in becoming a guest speaker, this is also possible. Please fill out the interest form. And if you're interested in receiving a certificate of participation, you will need to attend at least 3 sessions and submit some brief reflections. Please visit the Google form for more information. And now I'll be passing it to Erin to give us some final remarks.
Thank you all so much for attending. It was such an honor to see you all here and answer their questions. Thank you for asking them. And yeah, feel free to reach out to my email if you have questions, comments, curiosities, just want to chat. My inbox is open and I check it often. So yes, but thank you all so much.